After a two-day workshop training persons in the community to be HIV/AIDS testers, participants and master testers gave their review of the session. Andrea Williams, master trainer attached to the HIV/AIDS national program, recapped the session and gave an overview of what was done on the final day.
In our previous 2 days, we had our theory and we introduced the participants to some of the do's and don'ts of HIV rapid testing, what goes into producing quality results, some of the guidelines from the lab standards. And so today what we're doing is the practical hands-on experience where they actually get to test patient samples along with controls and to do their documentation. And we as the master trainers will be the ones to monitor exactly what they're doing, just to ensure that they're doing what they were taught and according to the instructions and procedures, so that they can issue quality results.
She spoke of other aspects of testing that is done.
These are actual samples from patients, and we also give them their controls, and they are to determine now how they will perform those samples. We know that before any testing we have to do our controls and do our documentation, so that is very important for them, and how they document the samples and their results. And so what we are actually doing is monitoring what they are doing.
Jacinth Williams Fraser, a nurse participant, shared her reviews.
I'm very happy that I was afforded the opportunity to get this training. HIV training done is something that I've always wanted to do, and it's very impacting for me because we see how us as nurses can be more involved in the lives of the persons in the community areas and around St. Kitts, and how we can help with the ease of HIV and AIDS, to educate, to keep confidentiality, to build relationship with those who are affected, and for those who want to come and get tested, to help it a little more easier for them.
Health educator and counselor Lucine Pemberton Vaughan stressed the subject of confidentiality.
We, the Ministry of Health, we are aware that confidentiality is key, especially when dealing with matters pertaining to HIV. And we would have done our own interviews with the participants prior to. So they have understood that it is imperative that they keep people's business and HIV status confidential. We have also highlighted that in the training in great depth, and they would have that form to sign off on, and they are taking an oath of confidentiality. For we know that when confidentiality is breached, then that makes it much harder for persons to come forward and be tested.
The sessions were held at the National Emergency Management Agency's conference room last Wednesday and Thursday.